Good afternoon. I'm Brooke Lovelace with the Iowa Developmental Disabilities Council. Thanks for joining us. It feels weird not to say happy Friday, and I don't want to spoil anybody, but this is actually Thursday. So if you were thinking it was Friday, because we normally do capital chats on Friday, it's not, and you have one more work day if you're joining us from work. But we are doing these capital chats on Thursday throughout the summer and a little bit through the fall after we did a poll to see when people thought it was best to participate in this, because we know folks during the summer like to take an extra day off for the weekend. So be joining us on Thursday at noon, and our next one will be won't be till August, so we're taking July off, and we'll go over those dates here, I think, towards the end. But we do have a special guest today, and we do have you for a full hour. So we're going to get started here in just a minute. I do want to just point out some housekeeping things. We should have an interpreter that's pinned for you there. Thanks, Elizabeth, for joining us today. And there is closed captioning with those using those three little dots on the bottom to get that going. We have a lot of information to cover today, but hopefully we will have time for questions. Amy's going to do a quick update before we turn it over to Carlin to introduce our special guest.
Yes, thank you. I went too far there, or maybe I didn't there. I'll go back. So I just wanted to give a quick update for those that didn't see it. Senator Julian Garrett died last week. He had been battling prostate cancer the entire session, so he did not come to the Capitol at all this session. He was out the whole time. So it was expected. Unfortunately, or fortunately, the governor does have to call a special election. It's in the laws, even though he was up for re-election in November and was not running again. They'll have to have a special election. Most people are thinking it will be the two people that are running for office in that general election that will be nominated by their parties to run in the special election, and that is Sanika Wo and Holly. I don't know how to pronounce her last name, Zaczek. And so if when you get on online, there's a link to their websites if you happen to live in this district. I also wanted to point out that three state representatives lost their primary. They were challenged from somebody within their own party. Representative Jane Bloomingdale, who is from Worth County up north by the Minnesota border. She lost her primary as well and is a Republican. Representative Brian Losey, another Republican from Bondurant, also represents Polk City and Granger around the metro area in Des Moines. He lost his primary. And he chaired the justice budget, so you might have heard his name before. Was real involved in civil rights stuff. And then also one Democrat lost, Representative Ken Crokin from over in the Davenport area. So that adds up to about 29 openings this year in our 150 seats. So a pretty good number of new people will be elected next year. And then, of course, any that are surprises in November. So I just wanted to give you a heads up that if you do live in that district, we're waiting to hear when that special election will be. And I'll turn it over to Carlin.
Thanks, Amy. Thanks for the update. And hi, everyone. I'm Carlin Crow. I'm the Public Policy Manager with the Iowa DD Council. And it's my pleasure to be able to welcome our guest speaker today. As you know, or may or may not know, during the summer, we focus our Capitol chats on the other Capitol, the one that's in Washington, D.C., and we talk about what's going on in federal policy and other things at the federal level. And I can just remember, like, a couple of years ago, we were like, what are we going to talk about? Like, there was not much to talk about. And now we have so much to talk about that there's no way we're going to probably get through even maybe this list today. But, and unfortunately, we have a lot to talk about. And we decided that it'd be a good idea again to invite Erin Prangley to join us to go through these this list and whatever else she may bring to the table. And I'll just let you know that these are the things that are the list that we presented to her as what we would like her to touch on. And she's expert in all things federal, so she may bring some other things to the table, and we may not get to all of them either. So just want to give you a heads up on that. And Erin is the Director of Public Policy for the National Association of Councils on Developmental Disabilities, which is obviously a very important organization for us because they not only analyze federal policy and keep us updated on what's going on at that level, but also they advocate for our funding and for funding for our sister organizations also. So we're very grateful to Erin for the work that she does, and very grateful to her for joining us today because she's also joining us while she's on vacation. So that's how committed she is to her work, and we really appreciate her joining us. So without further ado, I'm going to turn it over to her and let her take it away. Thank you, Erin.
Thanks, Carlin. It's really a pleasure to be here. And yes, I am on vacation, headed to where are we going? Carmel by the Sea. So the reception's a little spotty, but we're pulling over now. So hopefully this will be helpful. There is a lot happening. I might have to disagree a little bit with you, Carlin, because a lot of what's happening in Washington, D.C. is the result of legislation that passed last summer, H.R. 1, or the One Big Beautiful Bill, which put in place a lot of administrative changes that are happening now to Medicare. And of course, the president's executive order from his first day in office regarding asking agencies to review all programs concerning diversity, equity, and inclusion, which the Department of Health and Human Services has declared includes accessibility, which means disability as well. So they are reviewing all disability programs. Now, this started a year ago, but right now, Washington is starting to see the impact of those votes that they took in the executive order that is happening. So I will try to get through everything. I really will. And maybe even talk a little bit about the announcement on Monday that is going to realign the Department of Education within the Department of Health and Human Services. And I'll get to that too, because I think it's something that is going to take up a lot of our advocacy in the next couple of months. All right. Medicaid work requirements. Normally I have a beautiful PowerPoint for you. I might actually finish this PowerPoint and send it to you all afterwards, but unfortunately it's not quite done yet. As I mentioned, HR 1, or the One Big Beautiful Bill, it did have new requirements for Medicaid in it. Now these new requirements are significant because it isn't expected that what they will do is reduce the number of people on Medicaid. We'll get to that in a minute. But really what they were targeting was what many in Congress considered fraud, waste, and abuse in the Medicaid system. They really believed that people were taking advantage of the system, specifically people in the expansion states, because these were people who, because of Obamacare, they were expanding Medicaid to people who were otherwise not disabled, but impoverished. And so states had the opportunity to expand to that population so that they could provide healthcare services for more people and shore up or make the healthcare system stronger by providing more supported payments for people who were impoverished. Now, red and blue states opted into this. One of the most recent was North Carolina, and they opted into it because they were struggling, quite frankly, with rural hospitals and home community-based services. They simply did not have enough money flowing into their system, and so they took advantage of the hundreds of millions of dollars, if not billions of dollars, that came in by partnering with the federal government to expand healthcare to impoverished populations. This particular Congress, however, felt corruption wasn't work, and so they wanted to impose something called work requirements on this new. Remember, this is for the expansion population in these states. So, what does that mean? Well, these new work requirements would require 80 hours of work per month in education, training, community services, or other qualifying activities. The important thing to know is it starts January of 2027. And states are responsible for everything. States are responsible for setting up the systems to track whether people are working. States are responsible to defining what the qualifying activities are. And states are also responsible for coming up with any exemptions under the allowable exemptions that the federal government is giving them. Why do we care? Why do we care? Of course, everybody should work. If you could work, you should work. What's the big deal? Well, as we know from history, when states have tried to implement Medicaid work requirements before, they have not been able to successfully create a system that doesn't kick people off of Medicaid who were eligible, even without the work, even if they were complying with the work requirements. Why is that? Well, because the administrative burden it puts on the state to create a system that's foolproof, and on the individuals to file the paperwork and comply with these systems. The most famous case was from Arkansas, which a court had to intervene and stop their work requirement experiment because it was depriving people of due process. Just simply put, too many people were losing critical health services, including primary services, simply because they failed to fill out some paperwork. They were otherwise eligible, but the state was making many mistakes and not keeping up with the paperwork. And so people were losing critical services. So the courts put a halt to that. So it's important to note that people are concerned because no state has been able to implement requirements successfully, although several have tried. And so you're going to ask me, Erin, so why did Congress do this? Didn't you tell them not to do this? Didn't you tell them that the states don't have enough money to do this and to set a system up? Well, yes, I did. Well, a very senior senator staffer told me, well, Erin, we won't know how to do it until somebody does it. I said, what? And he said, well, the states will figure out it. We'll just have to wait to start with. So to me, it was probably the worst way of making policy I've ever seen in my 30 years of advocating. But it also deprived Iowa and your state and governors and state Medicaid directors from the ability to get before Congress and say, hey, what do you mean we're going to have to set up a system to monitor all of the people in Medicaid and whether they're meeting this rule? How can we make sure that we don't, make sure that people get the proper paperwork, that there are no notices that are missed, that the exemptions are verified correctly? How do we do all this? And why are you making us do it within a year? So it's bad policy. It was implemented, and now we're dealing with the consequences. And Iowa has already started dealing with the consequences of that. Well, let me just say, we were all waiting for CMS, which is the Centers for Medicaid and Medicare Services, to come up with guidance to tell the states how to implement these work requirements in a way that would protect people from being eliminated from Medicaid unnecessarily or unlawfully. And on June 1st of this year, they finally released the guidance. So states have something that they can start building these systems on. And frankly, the guidance wasn't very helpful. The guidance just kind of reiterated that the states are responsible for coming up with its own compliance systems and its own exemptions, and they must create their own reporting systems and monitoring systems. I think DD councils are very good at understanding what state systems look like, and to set up something like this so quickly is daunting and we know they're going to be big problems. So the biggest concern isn't that people with disabilities are required to work. The biggest concern is that individuals will lose their benefits even though they are exempt from having to work. So what are states doing right now? States are currently required to, number one, identify the exempt populations. Within the legislation, there is an exemption for disabled and medically frail. Most of our DD populations who access Medicaid through Social Security, so if any of you are familiar with people who are receiving home and community-based services, for example, those people are going to be exempt because they have accessed Medicaid through Social Security, through a determination by Social Security that they have a disability, they're not able to work, and therefore they're qualified for Medicaid. So let's just be clear. We don't want people to panic too much. Most people will be exempt if they received their services through anything other than the expansion population. But the states have to verify that those people received that information, that those people are exempt, and they will have to do so through their own state monitoring system. So even people who are receiving Medicaid, have been receiving it their whole lives, the state still has to verify that those people are exempt for that reason. The big problem with one of the CMS requirements is that they are saying that self-attestation might not be enough. And what that means is that many of the states were just going to have people say, yes, I am exempt, and check the box based on my disability. Right now, CMS is asking the states to do a little bit more than that, and that's going to be very difficult. So the question is, how is Iowa going to meet these work requirements? And what if they don't meet the work requirements? It's going to be a tight deadline to try to come up with a system by then. But let's say they do. What do we do right now to make sure that that system is the best system possible, that people aren't kicked off of Medicaid? And I understand that there's already been state legislation affecting the Iowa health and wellness plans, and many policy makers, probably because of your advocacy, have already argued that that these workforce requirements are not sustainable and are going to be difficult to implement. What Iowa will have to do now, and hopefully you're working with your Iowa Medicaid director, is to figure out how exemptions will be identified. So how will people be able to say, I do not have to, I am part of the exemption that Congress created for people with disabilities because I receive Medicaid through a traditional Social Security pathway, or because I have a disability that that meets the medically frail provision and am unable to participate in any of the criteria. So will they be able to just check a box, or will they be required to get a doctor's notice, right? By the way, many people have said that if you if you don't have Medicaid, how are you going to get a doctor to evaluate you for whether or not you are exempt, because you can't afford to go to the doctor to get the evaluation to show you're exempt. So you can see how that's going to be a problem for Iowa. The second thing is, will HCBS participants be automatically exempt? Many states are talking to their Medicaid directors who are putting this together, and they're saying, well, we know who receives home and community-based services, and you can only get that through the Social Security pathway. So let's automatically exempt all those people. So that's one thing that states have to decide. So when you're advocating, making sure that all HCBS participants are automatically exempt is important. The other thing is, how will caregivers be treated? Caregivers who are receiving Medicaid, and there are many of them, consider the parents of adult children with developmental disabilities who are impoverished in these expansion states. They may be receiving Medicaid. How can we make sure that we don't start a caregiving crisis by kicking off a bunch of people from Medicaid who are caring for our population? And then finally, what outreach will be available to people with intellectual and developmental disabilities to make sure that when they receive those notices, they understand that they must respond or risk losing their Medicaid. So, you know, a lot is happening in DC. Not really. They just came out with this guidance, which provides very little guidance to the states. A lot is happening in Iowa because you all are having to come up with this system, and your deadline is early next year. So I guess I would. There are a couple things that we're recommending from NACDD. At the state level, we are recommending that folks are meeting with their state Medicaid directors and their state DD directors. The state councils and through your council meetings, I think, are a great way to do that. And what you want to do is push for automatic exemptions from these work requirements based on medical frailty, based on someone's attestation that they cannot participate because of their disability. Monitoring state implementation. This is very important. Many of the states are sorry, Carol, I just put something in the chat that you should be. Sorry, Brooke Lovelace just put something in the chat that there's a Medicaid town hall today, and it would be great for advocates to ask how they're implementing this, and that you can register. Please, everybody on this call, register for what Brooke just put in. And Brooke also added that Iowa plans on implementing the work requirements December 20th, 2026. So it's really super important that you attend that town hall. And I would ask them specifically, what are the opportunities for us to review the exemptions and the systems before they go into effect, so that no one is taken off of Medicaid, wrongfully taken off of Medicaid, and also push for automatic exemptions. People who say they have a medical frail disability should be exempt. People who are already receiving HCBS services should be automatically exempt. They shouldn't have to fill out paperwork saying that they're exempt. On the state implementation side, Brooke and some others at the DD councils have a state tracker of what states are doing to implement work requirements. Many states have already put out their systems for how they're going to do this. It's important that when Iowa starts coming out with its plan, that we report that plan to the national organizations that are monitoring the implementation of state systems. We believe very strongly at NACDD that people will lose coverage. History has shown us, because of the Arkansas example, that when they try to implement work requirements, people will lose coverage, not because they're not eligible, but because of the administrative burden and the short timeline. We believe this is intentional. We believe that this is part of the federal government's plan to save over almost $10 billion in the next 10 years. $10 trillion over the next 10 years by having people removed from Medicaid through no fault of their own. So we are carefully anticipating the story collection. If anyone does have a disruption in their Medicaid services, regardless of why, regardless of their circumstances, we are urging you to open a case with your member of Congress. They will say to you, we don't administer the Medicaid system. You have to talk to your state Medicaid director. We are advising you to say no. I would like you to open a case because your members of Congress said that my Medicaid would not be hurt because I have a disability. And now I have a disability and I am now not receiving my services because of what you passed last summer. Because of work requirements. Please work with your DD council to get those stories to us. We know what's going to start happening and we're going to start collecting them. Finally, there is a comment opportunity to CMS. As I mentioned, CMS rule, the guidance was not great, and it actually caused a lot of confusion. So many state Medicaid directors are submitting comments to CMS asking for additional clarification on who would qualify as medically frail. NACDD will be submitting comments to CMS saying that the timeline for implementation is unrealistic and will cause irreparable harm on people because they will lose access to services. But there is a comment period, July 31st, 2026. I would like to pause, Carlin, if it's okay, and see if there are any questions from people. That's about all I was going to say on Medicaid work requirements, but I do want to make sure that I didn't confuse anyone, or if anyone needs me to use plain language or go back, I'm happy to do so. Uh-oh. Am I frozen?
No, you're
Nope,
good.
you're good.
Please don't be overwhelmed by this. If I could say one thing, I would say, again, most of our IDD population should be exempt because you receive services through your disability. But meeting with your Medicaid state director and your DD director would be critical. And I would strongly advise that your DD council, try to get them to come to a regularly scheduled council meeting. But as Brooke said, getting on that call today is also very important to make sure that people who are currently receiving HCBS services are automatically exempt and don't have to fill out any forms or anything that would make them lose those services through no fault of their own. Everything else is gravy. So that I think is really important. And also start collecting stories. So why do I want you to report it to your member of Congress? Again, don't you push back at them when they say this isn't our problem, this is your problem, and I'll help you get someone to help you fill out the paperwork. You push back and you say, thanks for helping me, but I want a case opened. And the reason is I need to go back to Congress and I need to say, Congressman, remember when you told me that people with disabilities would not be hurt because you passed this work requirement thing? I need you to talk to your district office and ask them how many people have lost services because of this work requirement thing. And then I now need you to ask them how many of those people have disabilities, because we believe that number is going to be quite high. But we need to establish that data. Okay, I will move on just in the interest of time. Medicaid fraud and program activity. Oh boy. Okay. This is one of those kitchen table discussions that I have to explain to my friends all the time. It seems that everybody knows somebody who's committing Medicaid fraud. I'm like, oh, really? Oh, yeah, I know someone who's, he can totally work, but he's getting disability. And I saw him fixing his roof yesterday. I had this conversation with someone. I'm like, oh, you saw him fixing his roof yesterday? She's like, oh, yeah, he totally shouldn't be getting disability. I said, well, first of all, you don't know what his disability is. So there's that. Secondly, what kind of fraud are we talking about? Are we talking about individuals committing fraud? Are we talking about providers who are billing for things and not delivering services? I will say that we lost that argument because even though, most of the fraud that we're talking about here is committed by providers, a lot of them in nursing homes, a lot of them through hospice and other things, it is the individual who is being demonized. People who really need care are going to lose care because people lack empathy and they look at someone, they say, oh, you're not disabled, therefore you're committing Medicaid fraud. Let's allow for the fact that there probably are pretty bad people who are committing Medicaid fraud. And guess what? Those are bad people. I don't even know why you're hanging out with them anyway. But the second thing is we have plenty of investigations and we can show that the state of Iowa, all the states have done an exemplary job of tracking those down, investigating and tracking those cases down. And it's really the individuals who get popped more than the providers. But that's where we're at. So we want to blame people, individuals, and we want to fix that problem by saying the entire system's messed up, so we're not going to give the state any money for Medicaid until they fix their system where there's 0% fraud. We know that that's not going to happen. So instead, the federal government has gone about targeting individual states and asking them to provide more information on how they are protecting against fraud, waste, and abuse. And every single state that has been asked to provide information has provided information. But they are continuing to take dollars away from states through different funding streams. So your state of Iowa, although you're not currently on the hit list, it's very possible that CMS and that the administration may be looking in general at your Medicaid system to make sure that you're doing all you can to protect against fraud, waste, and abuse. Now, for those of us who are old enough, which is only 5 years old at this point, we know Iowa has already implemented several systems, including electronic visitor verification, to make sure that Medicaid providers are actually providing the services that they're supposed to be providing. But states will lose federal dollars because of this Medicaid work requirement thing. And like I mentioned, $10 trillion over the next 10 years in state funding. And because of this, provider payments are going to be harder to sustain. And we are concerned that providers, they're going to do what they have to do to try to stay in business, and they're going to face additional budget pressure. It's very likely that when the federal government pulls back in its support of Medicaid, state systems and state budgets will try to take on that burden, because the need for services doesn't go away, but the federal funding does. So what happens when the states have to absorb additional costs? Iowa, I just checked this online, so you can tell me if I'm wrong, but your state legislature has already taken a whack at Medicaid in the state budget. And recent state actions included increasing taxes on Medicaid managed care organizations, using the general fund dollars to offset Medicaid shortfalls. And the state, Axios reported that the state projected about a $91 million Medicaid shortfall just this year and $168 million in the next year because of these changes to federal funding. So your state is already preparing for this Medicaid shortfall by trying to find additional funding in your general fund and by increasing taxes on managed care organizations. I would be very interested, and again, I mentioned we have this tracker on HCBS services. I would be very interested what you have seen in terms of changes to your Medicaid system through the state budget this year. But we could go to that later. But we will be seeing changes to the way that the state pays for Medicaid, and it looks like in your state they're going to be working with the managed care organizations and trying to tax them more and trying to get them to provide more funding for providers, and we'll see how that goes. Other states have different strategies, but that's what we're hearing that Iowa is doing, is working with your MCO. Does anybody have any question about the fraud, waste, and abuse issue that's happening right now? Oh, I'm concerned. I'm talking. Oh, thank you. And Brooke just put the HCBS tracker into the chat. So if you can have access to your chat, if you click on that, you'll see what other states are doing right now. And the changes that they're making to their HCBS and Medicaid systems because of the anticipated budget shortfall. And it's pretty scary. Raising provider taxes is one, but limiting services, cutting services for cutting funding for family caregivers is another. There are a lot of things happening in anticipation of the federal government paying less for Medicaid. Okay, in the interest of time, I'll move on to the next one. The accessibility rule delay. So there are two big litigations right now that NACDD is following. And this is one of them that we're kind of following. So in 2024, we were very excited, and NACDD and I think Iowa, a lot of the DD councils had been working for years to make sure that there was a regulation that required state and local governments to make websites and mobile apps accessible to everyone, including those who are blind, people with developmental disabilities, communication issues, and other types of issues. And that would comply with the ADA, Title II, which is regarding public accessibility. The other legal reason why the Department of Justice and HHS did that was because of the Rehabilitation Act, Section 504. They made a change to that to say that anyone who received federal funding had to meet digital accessibility standards, and this was based on 504, which is a different federal law. So these rules took years to make sure that everyone can access the internet. Why was that so important? We all remember COVID. So much of the services that we get now are online. And if it isn't telehealth services that we're getting, then it's scheduling appointment services or it's employment services. There are so many reasons now that, that the way that the state and local governments do business has to match accessibility rules that were established back when we didn't have the internet, right? So we're modernizing it. We're updating this to match our existing federal laws. This isn't a new law. We should all have access to public spaces, and we should all have access to government benefits. And because we're required to use the internet more, we're updating the regulations to make sure that we are in compliance with that law. Makes a lot of sense, right? I thought so too. But in May of 2026, the Department of Justice issued an interim final regulation, which delayed the compliance of this new regulation. So the delay of the compliance means that for Title II, having to do with some of the accessibility, it won't go into effect until 2027 or 2028 for smaller companies, smaller public entities. And that for public companies or MCOs and other things like that, they won't go into effect until 2028 as well. So that created a problem legally. And so the National Federation for the Blind filed suit. And their suit was based on a bunch of different legal beagle issues. One, lack of notice and comment, and secondly, that it was arbitrary and capricious. NACDD and the councils do not retain attorneys to file this type of litigation, but we follow it carefully and we care about it a lot, especially because of the first cause of action, the failure to have notice and comment. So these rules should have gone into effect, and the fact that the administration came in without going back to the public and expressing why they felt that these rules should be delayed, they just delayed them. That's problematic. But also it's problematic because we see, we see this impacting our community, and we need to do something about it. NACDD is not a party to that lawsuit because we don't retain attorneys to do that. We are monitoring it, however, because usually what happens is as it works its way through the courts, they will ask us to join an amicus brief or friend of the court brief to talk about the harm that's created if this interim rule, if this delay is allowed, and we will definitely be on the lookout for that. The other lawsuit that's happening is Texas versus Kennedy. It used to be Texas versus Becerra. That was another challenge to Section 504, which was much broader, and it would eliminate the integration mandate of the Americans with Disabilities Act in Section 504. It's very scary. I don't want to scare you too much about it, but the good news is when this lawsuit was filed last year by several states, mostly actually all of them kind of, red Republican conservative leaning states challenged the constitutionality of this part of the Rehabilitation Act. The advocates got involved, and originally there were 17 states that challenged the constitutionality of the civil rights statute. Because of your advocacy, only 7 states remain. The attorney generals for 10 of those states have changed their mind because their advocates have come to them and said, this is this is an important statutory right. You can't take this away from us. And they convinced them to drop the lawsuit. I've never seen that type of advocacy before, but I know many councils were part of it. The states that remain in the lawsuit, Iowa is not one of them. Alaska, Texas, Florida, Missouri, and let's see, who is that? Montana. So we're hoping that those states drop the lawsuit. NACDD has become a amicus brief. We have joined an amicus brief to say that obviously if Section 504 was ruled unlawful, that would cause irreparable harm to our community, especially those rules that they're asking to be unlawful. Okay. Does anybody have any question about the NFB lawsuit or Texas versus Kennedy? I'm going to go quickly through budget reconciliation. So, Congress doesn't really follow its own timelines anymore. Every year, they're supposed to have an appropriation or the amount of money that we're supposed to spend on certain programs by October 1st. Well, for the fiscal year of 2026, we still didn't have funding for the Department of Homeland Security completely until I think last week or the week before. But now that all the agencies have been somewhat funded, through something called budget reconciliation, this particular Congress is looking to reopen the 2026 fiscal year budget again and try to make some changes to Medicaid again. Right now, it's only rumors. I haven't seen any text, but the reason why they do that is because they're under a lot of pressure to cut Medicaid more. And they want to do it before the election. I heard you guys talking about elections a little bit earlier in your state elections, and that's very important. Some people have projected that the national elections may see a turnover from Republican to Democratic control of certain houses. So right now there's a real push by people who feel strongly about fraud, waste, and abuse in Medicaid to use the budget reconciliation process to put further restrictions on Medicaid before they lose the majority. I don't think it's going to happen. That's Erin's crystal ball, which has a few cracks in it, but I just think that's not going to happen. I think the timeline is way too short. But the uncertainty around federal funding is happening now, and I think that will happen. For example, the DD Council funding. We still are in the appropriations for next year, and guess what? We won't, we just had a hearing 2 weeks ago, and we're looking pretty good, but all the rumors are that we will not have funding by October 1st, and that once again, the DD councils will be under something called a continuing resolution until the next Congress comes in. And then when the next Congress comes in, they'll get to decide how much funding the DD councils get. It's not just the DD councils, it's all the programs funded by the federal government. The other federal funding uncertainty right now is that there was a regulation that was released from the Office of Management and Budget about 3 weeks ago that said that the federal government could not support any further grants that had to do with diversity, equity, or inclusion. So many of the state agencies are starting to review grants to see whether or not they can continue to fund them if they are participating in any diversity, equity, and inclusion functions. This is very concerning because the Office of Management and Budget has determined that disability is included in that definition. So we are working on comments to the Office of Management and Budget to say that the DD Act grants, for example, should not be included in the DEI statements, should not be defunded, and that all the work that we do with our subgrantees, for example, APSE, which is the Employment First group, that they are also not subject to the president's anti-DEI initiatives. So the funding issues in Congress remain very uncertain, and we are very concerned about this most recent regulation saying that the federal government should not be funding disability inclusion work. That's when I get back from vacation next week. That's all I'm going to be working on. Does anybody have any questions about federal budget or federal funding pressures right now? Listen, if I were you, I would focus on your state advocacy and your HCBS work right now. I do think that if the federal government does do something as ridiculous and unimaginable as trying to defund disability services, it would be subject to immediate review, judicial review. And because the DD Act statute is so clear that our job is it uses the word inclusion in our statute. I don't think that this administration could take money back from us because Congress is clear intent. But many of our friends who do not have a statute attached to them, we are very concerned about, and we, especially if they receive federal grant funding, and we will be working on that issue. But if I were you, I would focus on your state and your HCBS and your Medicaid work requirements. And I will follow up with you later on this newest thread. So what do I have left? I have left. What do I have left? Budget reconciliation.
Erin, can you talk a little bit about the movement of the special education to HHS and civil rights?
That's what I have next. Okay. So when the president was elected, one of his big promises was that he was going to re-envision the way that our agencies handled education, that education belonged in the states. And I agree with him. Education is not in the Constitution, so it is not a federal law. Education is something that is left up to the states because all of our states are different. We're all going to have different approaches to how we handle education. Where I disagree with the president and the administration is that there's no role for the federal government in education. Because in fact, when the Department of Education was created, which was back in the 70s, I think, somebody can check me on that, but it was a while ago. When it was created for a specific purpose. The creation was because states were not providing equal opportunities to their students. Their systems were set up so that not all children were receiving the same education. And it was based on, where they lived, redlining, which means, certain populations were, racially, segregated, and other things. And that was leading to some real disparities in education outcomes. So what the federal government said was that's a civil rights issue. If you look at the numbers and you see people with disabilities are not receiving education at all in some states, that's a civil rights issue. So we're going to create this oversight and we're going to create a statute that provides funding called Title I funding to states. And in order to get that funding for low-income schools primarily, in order to get that funding, your state has to agree to follow all of our civil rights laws regarding non-discrimination in education. So in addition to the Civil Rights Act of 1969 and then Title IX that came a little bit later, 1960, Civil Rights Act of 1960 something, not 963, and Title IX, you're going to have to follow all of our other civil rights that we determine people, and which would later come to include Individuals with Disability and Education Act. So the states don't have to follow civil rights, right? They don't have to. But they do if they take education money. And the education money that most states take is about 10% of their education budget. Some states take a little bit more based on their population and poverty formulas. But it's a big chunk of money. So all the states want to take that Title I funding. But not a lot of the states like the whole civil rights-y things attached to it. Things like the Individuals with Disabilities Act, which requires the free and appropriate public education, regardless of someone's disability, right? A lot of states struggle with that because you'll see segregated classrooms. You'll see seclusion and restraint. You'll see all sorts of things that don't comply with the Civil Rights Act, which is IDEA. And so states don't like that. They don't want to have to follow that kind of stuff. So the administration agrees that the federal government needs to give more authority to the states and needs to stop having such a heavy hand in its enforcement of these civil rights. That the department itself has gotten too big, too out of control, is exerting too much influence, and they need to make it smaller and give more authority back to the states. So the Secretary of Education proposed getting rid of the Department of Education completely and entering into contracts with other departments to take over specific education issues. So originally they were looking at the Department of Labor, the Department of Education, and the Department of Justice as places where the Department of Education would no longer enforce, for example, IDEA. They would turn that over to the Department of Justice. Well, they turned a lot of things over through these subcontracts, and the information that was shared earlier this week is that the disability programs would go to the Department of Health and Human Services. What does that mean? So what, Erin? They just sent it to another department. That's not a big deal, right? Well, Congress, first of all, has a say in where the money goes. And so there's a legal argument here that the administration could not take the entire Office of Special Education Programs and move it to a different department without consultation with Congress. So that's a legal question. Why is that important? Because Congress has a much broader view of the role of the federal government in education than any one administration, any one president, right? Because the one president's there for 8 years. Congress represents all of us. They see the long term. They have hearings. They're deliberative about these things. It's not like on a whim. So there are many that are concerned that this particular move does a couple things. Number one, it devalues the role of education in federal policy. So education has not always been as accessible as it is now. And many people think the reason why is because there has been strong enforcement of IDA, because we've built a special group of lawyers at the Department of Education, a special group of trainers at the Department of Education that go out to the states and provide training on what free and appropriate public education looks like. And if you remove that from the Department of Education and you give it to the Department of Health and Human Services, you're not taking those employees with you necessarily. You're losing all of that expertise. The other thing is you're probably losing money, because if you're no longer supporting all of these employees and you're no longer supporting the physical assets, the buildings and other things like that, there's going to be less funding that goes to it. And so everyone's going to say, yay, we saved money by giving it somewhere else. No, because fewer people will be doing the work. Fewer people who don't have the expertise, because they're not education professionals. They're not bringing all of the education folks into the Department of Health and Human Services. They're just giving the Health and Human Services an entirely new portfolio to deal with. So all those people will have to take on additional responsibilities without necessarily the additional employees. We saw this administration do this in the beginning when we saw the massive layoffs at the Department of Education, Department of Health and Human Services earlier last year. It is something that the disability community is rather united in opposition to, but the question is, how can we stop it? And that's a really good question. There will be a legal component to that. The states will be very involved in that. I think it would not be a bad idea to speak with the council to invite the Secretary of Education for your state to come and talk a little bit about how the state is preparing to have less trainers, less funding for helping teachers and school districts comply with the IDEA. It's gonna be a burden on your state. Your state's gonna have to pick up the slack, because once again, just because there are fewer federal resources and fewer federal money doesn't mean the law still doesn't apply. So you won't have the same sort of support for your school districts and services that you have now that you had before. And the state is going to have to make some budget decisions as to whether or not they want to provide that additional training and support for their local school districts and teachers. Universally, no one in the disability community thinks this is a good thing. We think it's a really bad thing, and we think that there will be more violations of students' rights. There will be more segregation in classrooms. There will be more seclusion and restraint because we won't have that oversight that we currently have with the strong Department of Education who, all the decades I've been alive, has been moving towards, a robust system of enforcement so that children with disabilities have a free and appropriate public education. Wow, I talked a lot, but happy to answer any questions on that, although that is still developing.
Thanks, Erin. If anybody has questions, go ahead and put them in the chat or just come off mute. We have a couple minutes left. 3. You did great, Erin. Good timing.
Well, I was hoping to hear a little bit more about what's going on in Iowa because I know you guys are working so hard. If anybody has any updates for me, that'd be fantastic.
Well, you mentioned the HMO tax earlier, and that was it's a short-term big tax that's going to reduce back to almost its current level before the law passed in October. So it was it was to fill a hole that was already in the Medicaid budget. So that's not even accounting for upcoming, potential Medicaid shortfall in the budget. So we're already backtracking to try and fill in a hole by doing these extra HMO taxes. And so, more to come on that, but the state has been pretty quiet about how they're going to address the Medicaid shortfall. And I know that has come up in other states, which, we hear stories of other states who are already preparing by announcing publicly they're going to be cutting services. And we haven't heard anything like that yet.
Well, one of the things, and I'm not going to pick a side, but one of the benefits to having managed care organizations in your state handling your Medicaid is that it is all done through a contract. So when these funding issues happen, you can look to fix those issues through your contract. Or when eligibility things happen, you can look to your managed care company and say, do you really want this to happen? Or should we figure out a way, to make sure that, you're not losing, that people aren't losing eligibility. So managed care can be an ally in some of this. Will they be a willing ally to pay more taxes and be happy about it? No. But the fact that your state was able to get that through, considering the political strength of managed care, I think indicates to me that managed care knows that they're going to have to carry some of this burden. Otherwise, they're going to lose all their clients. I mean, what's going to happen to providers if Medicaid no longer pays for them? They're gone, right? So what's going to happen to their business model? Something's got to give. And the pressure that states are putting on their MCOs through their contracting is an interesting way to approach this. Now, the capitalist in me says, I'm the anti-capitalist in me. I don't necessarily think the marketplace is going to be able to solve this issue. I think that healthcare is more of a civil rights issue than a marketplace issue. And I think that, trying to come to a solution through contracts and working with managed care to fill short gaps and is going to have problems. I think ultimately we need to kind of think more clearly about the underlying statutes and the social safety net of Medicaid and why it was created and shore up that system before we look to MCOs to try to come and save us. I don't agree that strategy is going to work, but it could be a short-term solution until democracy catches up.
Well, and with that, we probably should let you get back to your vacation. And thank you so much for coming on and delivering an enormous amount of information and help to all of us here in Iowa. And
you've all been so kind. And I just want to invite all of you. Every other week, I have public policy hours. So ask Brooke for the link and please sign up. And you're welcome to come and ask me more questions. It's open to all state councils and advocates. And I hope to see you guys there.
Thanks again. Have a great vacation.
Thank you. Take care. Bye.